Welcome everybody, Dr. Cody Gordon here. We're going to talk a little bit about tissue healing, injury recovery on a cellular level. We're going to start off by talking about this little molecule ATP, stands for adenosine triphosphate, and it's the energy molecule your body uses inside of the cell to run all cellular functions. It's primarily made in the mitochondria of the cell. We remember that from high school biology as the powerhouse of the cell. And ATP is often referred to as your cellular currency. It is the gasoline that powers everything in the body, everything that you do. And so we want to do things that can really elevate that ATP production, and because it happens mostly in the mitochondria, we want to do things that can support the mitochondria. So what kinds of things can we do? Well, nutrition is a really important thing. Healthy nutrition can support the mitochondria, and you can look into some very specific ways to do that. The other thing is rest. We want to get adequate amounts of sleep. Reduction in sleep over time can really wear out the mitochondria, not give it adequate downtime, and he doesn't produce as much ATP. So we want to make sure we get an adequate amount of rest. Now, how do we harness the use of ATP and energy in the cell clinically to help people recover from injuries? Well, in my office, I like to use a class 4 deep tissue laser for that kind of an application. Laser functions at a nanometer length of between 980 and 810 nanometers, which is a really long wavelength, and it penetrates really deeply into tissue, and light can stimulate that mitochondria. It's another great thing we can do to try to stimulate mitochondria activity is just get out in the sunlight. Enjoy some sun on your skin. But the long wavelengths, the near infrared and far infrared wavelengths of light will penetrate through tissues and will stimulate that mitochondria to produce ATP, bring it up to its highest functioning rate, so to speak. And so when we've had decrease in mitochondrial function, or we're producing less ATP, we're displaying less vitality, and what we want to do is display increased vitality. We want to feel good and vital, and so if we can increase that light exposure to that mitochondria in a localized area where we're maybe having some deficits from an injury, an inflammatory problem, overuse problem, tendonitis or irritation to muscle tissues and joints, we'll use deep class 4 deep tissue therapy to stimulate the mitochondria in those areas. Laser will also stimulate vasodilation. We'll get good drainage of blood flow from the area, because that involved area is usually very inflamed, and we want to drain the inflammation out of that area so that it stop causing so much discomfort and pain. Laser is often a short course therapy. We'll do maybe 3 to 6 treatments in a fairly close proximity to one another, and treat to near resolution but not complete resolution. If I can get somebody to about 70% better than they walked in, they're probably going to continue to heal on their own without continued treatment. So we'll bring them really close to where they need to be, and then discharge them with the understanding that they can always give us a call back if the problem plateaus or regresses in any way. But for the most part, they're going to continue to experience improvements once we've gotten that ball rolling for them. So that's how we harness the use of ATP energy in the cell to overcome pain phenomenon, whether chronic or acute musculoskeletal pains in the body. And we use in our office deep tissue laser therapy, class 4 laser therapy to accomplish that task. Hope you've enjoyed this video, and we'll see you again next time.